Well, when dealing with addiction, it's important to have the right support to reach recovery. Here to tell us about a treatment center and options at Clarity Way are Dr. Robert Matalevich and Jack Gilbert. Welcome.
Hi, thank you for having us.
Thank you for coming. This is a super important topic. And we couldn't have more right guests here than you guys to tell us all about Clarity Way. So what is Clarity Way?
We're a 27-bed, small, inpatient treatment facility for substance abuse. We're located in southern Pennsylvania, between York and Hanover, and we offer intensive inpatient programs.
Okay. And so what are the different treatments out there? What kind of treatment centers and options are out there for somebody who feels like they might be an addict or have an addiction issue?
Well, there's a lot of different options out there. What I can tell you about is Clarity Way, which is we're a smaller facility, as Dr. Matalevich mentioned. One of the things that I think we do a great job of is removing the barriers to getting into treatment. One of the ways that we do that is we allow our clients access to their electronics, and there's a reason for that. A lot of people, a barrier for treatment is they just can't step away from work or their life completely, or maybe they have young kids or a loved one that they're taking care of. And so the ability to be able to maintain some work while they're really focusing mostly on their treatment, as well as being able to have contact with their families, being able to FaceTime their kids at night. That can really be the difference between somebody coming in and getting the treatment that they really desperately need versus not doing so.
That's amazing.
Right.
It really makes life livable while bettering yourself and getting on the right path.
And the reality is when they leave treatment, they're going to have their electronics. So, and if it gets in the way, obviously we address it as a treatment issue.
Okay. And so what is your approach to treatment, and what is individualized care?
Our approach to treatment, we are a holistic program. We believe in taking a mind, body, and spirit approach because addiction affects all those different aspects of a person. In terms of our individualized approach, we deal with clients with their individual issues, the things that really fuel their addiction, things like anxiety, depression, trauma, shame and guilt, grief and loss. We educate our clients about the biological, psychological, and social aspects of addiction, and also teach them practical recovery skills. How do you navigate life in recovery when different issues come up? You know, if you're at a family holiday celebration, how do you get through that? What kind of tools can you have? We have a very dynamic, holistic program as well, and it's the combination of the clinical and the holistic program. The idea is to be able to help people identify their underlying issues and then to teach them healthy, adaptive coping strategies so that they're able to use those in place of drugs and alcohol. The other thing I would just mention about the individualized care is that because we're such a small facility, we only have 27 clients when we're full, every care provider there knows our clients personally. We know their histories. We know what issues that they're dealing with. We know if they're having a difficult day. And you just are not going to get that level of individualized care at a larger facility. It's just not possible.
It's amazing. And being an individualized facility, everybody's life is so different. And you can't always turn your life 180, especially when you have children and a job that you need to maintain when you go through here. So something like your treatment would be absolutely life-changing because they can do these things while continuing the life that they know.
Exactly. One other thing I just would like to mention that I think is really important about Clarity Way is some facilities take a specific approach. For instance, they may be step-based. They may use the step model, and that's a great model, and we use that at Clarity Way.
Okay.
For some people, that can be a barrier to treatment.
Right.
They've gone to those types of support groups, and they don't work for them. So one of the things that we also do that's really unique is we provide on our campus every day of the week different types of support group meetings. So we use step treatments. So we have AA, we have Dharma recovery, which is Buddhist-based, and we have Smart recovery, which is a non-step, non-spiritually based program because we want our clients to be exposed to a variety of support group options because support groups are absolutely essential to maintaining long-term sobriety.
Community is everything, and you have something for everyone. Dr. Rob, your patients call you Dr. Rob.
Correct. Yeah.
So how does somebody know if they or a loved one may be addicted or have an addiction issue?
It's usually not a secret. Certainly we do have patients that come in where the family was not aware that they had an addiction going on, but you'll see most people start to disengage from their social responsibilities, family responsibilities, and financial responsibilities. There's troubles at work, at home, and you can usually trace that back to a substance. So it takes a good history, to understand what's going on with the patient, and that's what makes us unique at Clarity Way, is that we get to engage a patient early on. I get to do the medical evaluation and the detox part, and I work closely with Jack and the clinical team in formulating the treatment plan as we move forward, incorporating all the stuff that we've just talked about.
Yeah, just to piggyback on that, I think the other thing that we do very well at Clarity Way is we have an excellent interface and integration between the medical team, the holistic team, and the clinical team. And right, a lot of times it's obvious when a person is having issues with substances, but sometimes it's not. Other things, in addition to what Dr. Matalevich mentioned, would be things like legal issues, if you're finding things around the house, paraphernalia,
Right.
actual substances themselves. People start to lie, they start to steal. Another thing that is a telltale sign is that people become withdrawn.
Okay.
Addiction is a disease of disconnection. And so
Yes.
people become withdrawn, and using that substance, because it has become a coping strategy,
Right.
becomes the primary focus. And so it's really, we look at a cluster of different things. There's no one thing, but as Dr. Rob mentioned,
Looking
lot of
for
times-
all of the, looking for maybe
Right.
one of all
and then
of
reaching
this
out,
array of
and
things.
if a family has questions, they can reach out for community services to help. There's interventionists in the community. Or you can call a healthcare professional and
That's
get some advice.
perfect. So how do we get in touch with you? Where can we go for more information if we want to be?
You can call our facility directly at 717-225-3906 and speak to an intake coordinator. You can visit our website at www.clarityway.com. And you can view a list of all our services. And there are also further links on how to get in touch with intake coordinators.
Thank you so much. We have the information on your screen. If you or a loved one feel like you have an addiction, they can reach out to Clarity Way, and you guys are not far. Thank you so much for being here today. It's so important.
Thanks so much for
Thanks
having us.
And happy holidays.
Same to you.
Thank you.